Namaste Vidya, Hamisha Kusho Vidya. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, at Faculty of Homeopathic Science in JAYOTI VIDYAPEETH Women's University, Jaipur. In today's lecture, we are going to start with AV block and bundle branch block, that is BBB. So, atrioventricular block and bundle branch block. What is AV block? AV block is a type of block when the electrical signals from the atria to the ventricles are impaired. Electrical signals from the atria to the ventricles are impaired. There is AV conduction is influenced by autonomic activity. AV block is intermittent and only evident when the conducting tissue is stressed by rapid arterial rate. There are 3 degrees of AV block. Number one is the first degree AV block, second degree AV block, and third degree or complete AV block. So what is AV block? When the electrical signals from the atria to the ventricles are impaired. And we have 3 types of AV block: first degree, second degree, and the third degree or complete AV block. Now, what is first degree AV block? It occurs when the conduction through the AV node is slowed. So the first degree AV block occurs when the conduction through the AV node is slowed down, thereby delaying the time it takes for the action potential to travel from the SE node through the AV node and to the ventricles. So it occurs when the conduction through the AV node is slowed down. So when the conduction through the AV node is slowed down by delaying the time it takes for the action potential to travel from SA node to the AV node to the ventricles, the AV conduction is delayed, so the PR interval is prolonged greater than 20.20 seconds. It rarely causes any kind of symptoms. So this was all about first degree AV block. It rarely causes any symptoms, and the AV conduction is delayed, so the PR interval is prolonged greater than 0.2 seconds. Now we come to the second degree AV block. In the second degree AV block, it is a disorder that is characterized by disturbances, delay or interruption of the atrial impulse conduction to the ventricles through the atrioventricular node and bundle of His. The drop beat occurs because some impulses from the atria fail to conduct to the ventricles. So in second degree AV block, there are drop beats because of some of the impulses from the atria fail to conduct to the ventricles, and it is characterized by disturbed, delayed or interrupted atrial impulses conduction to the ventricles through the atrioventricular node and bundle of His. These are of 2 types: Morbid's type 1, that is one back phenomenon, and Morbid's type 2. Now, what is Morbid's type 1? Morbid's type 1, there is progressive lengthening of successive PR intervals with culminating in a drop beat. It is due to the impaired conduction in the AV node itself. The phenomenon may be physiological and is observed at rest or during the sleep in athletic young adults with high voltage tone. Now, in Morbid's type 2, the PR interval of the conduction impulse remains constant, but some P waves are not conducted. This is caused by disease of His Purkinje system and carries a risk of asystole. In 2:1 AV block, alternative P waves are conducted, so it is impossible to distinguish between Morbid's type 1 and Morbid's type 2 block. Now we come to the third degree or the complete AV block. In complete AV block or the third degree AV block, when the AV conduction fails completely and the atria and the ventricles beats independently. So there is no synchronicity between the atria and the ventricles. The ventricular activity is maintained by an escape rhythm that is arising in the AV node or the bundle of His or the Purkinje fibers. The distal escape rhythms tends to be slower and less reliable. It produces a slow 25 to 50 per minute and regular pulse. Etiology of complete AV block. There is idiopathic fibrosis, MI or the ischemia, inflammation or infective endocarditis, trauma, that is cardiac surgery, and drugs like digoxin and beta blockers. So etiology consists of idiopathic fibrosis, MI or ischemia, inflammation, that is infective endocarditis, trauma, cardiac surgery, drugs like digoxin and beta blockers. Now, how will you manage the case of AV block? The symptomatic second and third degree AV block may respond to atropine. The patients presenting with asystolic intravenous atropine 3 mg or intravenous isoprenylene 2 mg in 500 ml, 5% dextrose infusion at 10 to 60 ml per hour. External or transcutaneous pacing provide effective temporary rhythm support. So this was all about AV block. Now we come to the bundle branch block or the BBB. So what is bundle branch block? It is a condition in which there is a delay or blockage along the pathway that electrical impulses travel to make the heart beat. The delay in activation of ventricles broadens QRS complex and produces characteristics alterations in the QRS morphology. There are two types of bundle branch block, that is right bundle branch block and left bundle branch block. So this is a condition in which there is delay or the blockage along the pathway that electrical impulses travels to make the heart beat. Two types of bundle branch block, right and left. Now, what happens in the right bundle branch block? RBBB is a normal variant and the causes are right ventricular hypertrophy or strain, congenital heart disease and coronary artery disease. So we have the causes right ventricular hypertrophy or strain, congenital heart disease and coronary artery disease. Next we have the left bundle branch block. It signifies the underlying heart disease. The left bundle branch of bundle of His divides into anterior and posterior fascicle. The causes are coronary artery disease, hypertension, aortic valve disease and cardiomyopathy. Now, what are the clinical features? In most of the people, bundle branch block doesn't cause any symptom. Fainting, syncope, feeling as if going to faint or pre-syncope. The damage to the conducting tissue at the point where the bundle of His divides into anterior and posterior fascicles does not broaden QRS complex, but alters the mean deviation of the ventricular depolarization and causes axis deviation. So there is axis deviation in this. You will find fainting, syncope, feeling as if he's going to faint, that is pre-syncope, and left axis deviation in the ECG. Left axis deviation, there are two types of axis deviation we find: left anterior hemiblock that causes left axis deviation, and left posterior hemiblock that causes right axis deviation. Now, how will you diagnose such a condition? The diagnosis is made by electrocardiogram, ECG, and electrocardiogram and echocardiogram, two methods by which the diagnosis can be made. And the treatment consists of the pacemaker and cardiac resynchronization therapy. So in treatment, pacemaker is installed and cardiac resynchronization therapy is given. Now, what are the various complications that can happen in a bundle branch block? It progresses to complete block of the electrical impulses from the atria to the ventricles and can even cause sudden cardiac death. A combination of right bundle branch and left anterior and posterior hemiblock is known as bifascicular block. This was all about atrioventricular block and bundle branch block. In the next lecture, we will be discussing about infective endocarditis. This session is powered by digital version 2.0, JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve them. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow.